Happier at Home episode in 3, 2, 1. What is LTC at home? Long-term care at home. These services for patients, they're in their homes. They didn't go to a nursing home. They're not part of an assisted living nursing center who might otherwise be in a facility, even skilled nursing. LTC at home. This is a term that we are hearing over and over and over again on Happier at Home PRN on this episode. Wait till you hear this interview. I'm so excited about the expansion of LTC at home and what it represents in the shifting populations of patients preferring to receive the same care that they would receive at a long-term care facility in their homes. Stay tuned. Hey, there's an article out of Skilled Nursing News. Whole system is broken. And that's in bold letters. The whole system is broken. Nursing home operators and National Coalition say long-term care will need a generation to fix. It goes into all of the issues that communities across the United States are having and not having enough. They say beds. I don't like referring to organizations that care for people as beds. I like to think, how many patients are you serving? Not necessarily beds. I don't believe you serve beds, you serve patients. And with that, I think of the personalization of medication management and everything that our community pharmacies are doing to ensure that the people in their community are receiving the services they need. That's why I am so proud to have Debbie Marcello as a part of the Pharmacy Podcast Network, leading our podcast, Happier at Home PRN. Debbie, it's so good to see you.
Thank you so much for that introduction. It's always great to see you. And I am equally as excited about the powerhouse of a woman that we have as a guest today. She just sets her mind to what she wants to do and does it. I want to welcome Lindsay Demowski. She is the Centennial Pharmacy Services in Philadelphia community pharmacy owner. And she also is the co-founder of LTC at Home Pharmacy Network. Lindsay, thank you for being with us today.
Debbie, thank you so much for having me. I'm so excited to be here and to be here specifically with another organization that appreciates patient care in the home, because this is something that pharmacy needs to focus on, and we got to get the message out there. So this is exciting.
You're right. So you didn't think you had enough to do with your running your pharmacy, so you figured you'd start a whole nother venture. Is that what we're talking about today? I understand. That's what we entrepreneurs do. We have a little piece of a plate open and we got to fill it. So I'm so excited to talk with you today, and I love talking with our pharmacy owners that I've had on as guests, because I love hearing what their road has been like. I'm curious about how you became a pharmacist, how you opened your pharmacy. Can you tell me a little bit about that?
Yeah, of course. Well, like many of the listeners that I'm sure tuned in, I am a pharmacy daughter. So I grew up with my parents. My parents owned pharmacies, and I grew up earning my allowance by working the cash register, putting our drug order away, cleaning shelves outside. So, pharmacy has just been in my blood. I was literally born into it. And so, I always knew that I wanted to be involved in pharmacy, and I kind of thought that I was just going to go to college, go to pharmacy school, be a pharmacist, and take everything over in regards to the retail business that my parents had built. But there was just a different calling, I guess. I actually ended up seeing a automation technology to do pouch packaging for patients. And I thought that it was the coolest thing, because at the time in my family's pharmacies, we had just started with figuring out a way to get medications into people's homes more conveniently. We knew that bottles weren't really working. We saw a lot of gaps. And so we were trying to find solutions, and just manually blistering wasn't a great solution for our pharmacy. So I saw this machine and I said, we have to do this. We have to go into this. And um, my dad, who had been a pharmacist for years at that point, was like, I'm a retail pharmacist. I am not getting involved in any of this. I go in, I fill my prescriptions, and we leave. Um, and I I just really made my case. And fortunately, my parents had always treated the family pharmacies that we had as true family pharmacies. And uh, they always involved my brother and I in a lot of decisions, from naming to, kind of taking us out. And I remember my dad would pick me up from school, and we would go to like meetings with wholesalers, and I would start to learn about the
That's
industry.
great.
So yeah, we started just
I
talking
love
more
that.
about it. We decided that we were going to jump in 2 feet, get this technology, and start getting it out into the patient's homes. So we got it
Excellent.
in. We
How
started
long
going to,
ago was that?
oh my goodness. That was 2014 when we had originally started that. So it's
So
been
ahead of
quite a
your
while.
time. Yeah.
Yeah.
And so were your parents, I guess, I don't know if anyone was really seeing about how looking into the future and how the landscape was going to change. Were your parents on board with a lot of the more progressive ideas that you might have had to expand your pharmacy?
I think they were. Once they saw the impact that it was actually making on the patients, and how the patients were so thankful to have a way to organize their medications that made sense to them, and also how much the providers were calling up the pharmacy and saying, what is this? What's going on here? And the providers started to engage with us, not only more closely, but probably more respectfully. At that point is when we all knew that we had something going on, that we had to just push and shift our business model into that business model.
So really focusing on knowing that the population is aging and that people want to be able to remain independent and in their homes. And that medication compliance can really be a problem for people. So with this automated excuse me, automated packaging machine, then did you find that your revenues were changing as far as your profit margins at that point?
Uh, so not at first. It has been a long road to be able,
Mm-hmm.
increased revenues and increased reimbursement. We started just as traditional retail pharmacy. Then we actually migrated into a combo shop when um, a lot of the long-term care groups started recognizing that there were actually populations of individuals in the home who were chronically ill and who needed to age in place and weren't going to be supported by a facility. So once we were able to take advantage of some of those opportunities in long-term care, we migrated to a combo shop. And then we eventually started going to just all closed door long-term care, where we actually are supporting our patients, the patients who qualify for long-term care at home, through our pharmacy. And we technically operate as a long-term care pharmacy, but we're supporting community patients instead of those who are living in facilities.
Excellent. And do these patients, do you notice that they need multiple services to be able to stay in their home? You don't provide any DME or anything like that?
We don't, but there
Mhm.
are pharmacies out there who have a, a full full service of solutions that they provide to the patients. And
Mhm.
I really think it's wonderful when the pharmacies, especially your pharmacies who are in your more rural areas, are able to become that healthcare hub, because not only are they providing the medications and the specific pharmacy services, but then they also have the additional DME, clinical services. You can get into home care, which I just think is the coolest thing. So there's a lot of opportunities with being able to support this population, specifically because they are so chronically ill, they are aging in place, they don't want to go to a home, or they may not be able to afford to go to a home. So there's a lot of opportunities for pharmacies to be able to care for them more holistically than just providing medications.
Right. That's the wave of the future. They need to strategize around that for, let's say, for 2024 coming up. We know the DIR apocalypse is upon us very soon. And to be able to strategize and ways that you're going to be able to offset that, there's a light at the end of the tunnel, of course, but making sure you don't have all your eggs in one basket, and you're diversifying your services is really important. So I'm really excited to talk about your network that you are co-founder of. But I'm curious about that network, Lindsay. You're not a PSAO?
No, we are not a PSAO. Our goal at the network is to actually partner with PSAOs, and be able to provide that compliance piece, not only to the PSAOs, but also to the pharmacies. So the Long-Term Care at Home Pharmacy Network acts as a centralized hub for everything long-term care at home. Education, best practices, compliance documentation like attestation forms, and different needs that that pharmacies may find themselves needing for compliance reasons or audit reasons. It has been gate kept, and I don't necessarily think on purpose, but I think a lot of times in pharmacy, things are really, really difficult to find. So we realized that there was a need to get this information out there to pharmacies, to be able to put it all in one place, and to be able to provide additional tools and resources like the education piece, and different types of best practices, and just the availability to talk to people who are doing this in this industry, and make sure that pharmacies can fully take advantage of this sector, because our population is only getting older, our population is only getting sicker, and the typical retail pharmacies, it's difficult to operate a pharmacy these days. And I
Right.
mean, you just talked about the DIRs coming in 2024. I've talked to pharmacies who are taking out mortgages to be able to support the cash flow for that. It's
Mm-hmm.
terrifying. It's absolutely terrifying. So this is a way for us to get the information out there, make sure that pharmacies have access to it, and also provide any type of additional support, not only to the pharmacies, but to the PSAOs or to different groups that are looking to support at home in some way.
Excellent. So, just stepping back for a second, how is it that you determined that you wanted to start this network? Were you sitting around with your family and thinking, wow, I wish that we could provide these services for more people or help my colleagues? What were you thinking?
Well, we knew at Centennial that we had a model that worked. And we knew that we had a model that pharmacies were interested in, because we had a lot of different groups coming here, essentially asking, what do we do and how do we do it? We we know that the information for at home is available, but it's extremely, extremely hard to find. And it's also scary because it is a new sector of pharmacy, and providing long-term care into the community, not into a facility, can be a bit daunting because it hasn't historically been done before. So being able to take all of our resources and knowledge and package it for pharmacies to provide, I'm going to say a network because that's what it is, to provide a network that has all this information, really was our goal. We wanted to make sure that patients could be taken care of all over the country for long-term care at home needs, whether they were chronically ill, aging in place, if there was something going on, and they needed this type of pharmacy service. It shouldn't be isolated to a specific area. It needs to be something that's available to all the patient populations across the country that need it. And this was a way for us to be able to support the industry in doing that.
I love hearing that because I've heard so many times when you graduate from pharmacy school, you're not taught how to run a business. And so this gives people an opportunity to expand their business and improve their sources of revenue. But it also is stepping out of their comfort zone.
It
So
is.
are you able to kind of provide a roadmap or those step-by-step process for those that might want to start long-term care at home?
Yep, that's exactly what we do. So there are retail pharmacies who have not taken advantage of combo shop opportunities. Combo shop is what allows a retail pharmacy to have both a retail and a long-term care classic trade to be able to bill for retail or long-term care. So for the pharmacies who haven't started that process, we have a roadmap to be able to obtain the long-term care NPI, to get all the documentation order that they need, to connect them with the resources like the long-term care PSAOs that they're going to need to be connected to for contracting. For the pharmacies who have already done that, then we add the compliance support. So one of the big things in long-term care at home is the documentation of the patient care. How is that done? How is it done effectively? What is approved or not approved by different payers or different health plans? What opportunities are there for pharmacies to bill or be reimbursed differently for long-term care at home that they may or may not be aware of? Additionally, along with the roadmap of getting started, is all of that information so that it's right there in a centralized, I'm throwing my pen everywhere. It's right there, centralized hub for for
You
all the
talk as much with your hands as I do.
I know.
So, when you're providing these services for pharmacy owners, is there a membership fee to your organization?
There is. So we charge $79 a month for membership. And that gives pharmacies, each NPI, access to all the tools that we have, all the resources that we have. There are weekly webinars, lunch and learn type of activities with our team members. And there's always things being updated, newsletters going out, information being shared. So we feel like it's an effective solution for pharmacies to be able to get access to this information and keep up to date with all of it, because it is a new sector and things do change in this industry very quickly.
Well, I'm very excited to become one of your partners because I see how our happier at home business model would work so well with the long-term care at home, especially when you have, one question that came to my mind while you were talking was, well, how do you find all these patients, long-term care, the in-home care patients?
Yeah.
And, that's one of the questions. And I actually want you to answer that in a second, but, just thinking ahead, if any of your members in your network or anyone who wants to be able to provide the long-term care at home pharmacy has a happier at home business where they are expanding at their services and providing the light housekeeping, meal planning and preparation, personal assistant services, just those basic services to help people remain at home, which is on a cash-based payment, by the way. If we are promoting our franchisees and we have that name recognition in your community, we're able to attract those home care patients, and then you could naturally just start servicing them, of course, as long as they are qualifying for those services of long-term care at home. Those are patients that you can start servicing right away. So it's exciting.
Yeah, I mean that the population of patients who are going to be part of the happier at home ecosystem are the population of patients who are most likely going to be reimbursable under long-term care at home. And it's a no-brainer for pharmacies to be able to connect the two, because those individuals who need support with ADLs, which are activities of daily living or instrumental activities of daily living, who also are homebound, who I said homebound. I'm sorry.
Homebound, yeah.
Those patients who are homebound who have 3 or more chronic conditions and then take multiple medications for those chronic conditions. Those are the patients that you're supporting. Those are the patients that we're supporting for long-term care at home. So it goes hand in hand.
So, one of the questions I started asking you earlier was how do you traditionally, if you don't own a home care business, how do you get those referrals for long-term care at home?
Well, they can come in different ways. What we find is that a lot of community pharmacies already have these patients in their population. They're just not taking advantage of the opportunity to bill them under long term care. So first and foremost is looking at your current patient population in your pharmacy and identifying the patients through your current population. Additionally, we find that a lot of providers will actually send referrals over to patients who are in need of these types of services. We have social workers, especially social workers who are supporting independent living communities and other types of organizations like maybe adult daycare centers or places like that who know that these individuals, fit the needs. They can't leave their home independently. They're chronically sick. They're on a lot of medications. So we get referrals over from those groups, case management. And then, of course, we see a lot of referrals come over from home care agencies. There's a ton of home care agencies who are in the homes and they see what is going on with the patient in their home setting, and they know that they need support with their medicines.
Excellent. So, as you were rattling off that list of potential referral sources, those are common to our businesses, common to Happier at Home and the independent community pharmacists. So that's very exciting. There's so many synergies between providing that long-term care at home pharmacy services and the actual, as you said, ADLs or IADLs in their home. So we're talking about, instead of referring out to another company, being able to refer services to yourself and refer business, I should say, to yourself for those additional services to help your elderly and disabled populations to be able to stay home. So it's a
Yeah,
very exciting thing.
it really is. And like you said earlier, it takes that pharmacist who is just a pharmacist or just a pharmacy owner, and it really makes them put their business owner cap on, and it makes them think differently about where are we going to find our patient population, how are we going to support our ecosystem within our pharmacy to maintain these patients. I think that was probably the biggest challenge when we had first started in long-term care at home was, we're a pharmacy. It's kind of, no business is easy, but with pharmacies, you kind of open the door and you get patients. You're able to get prescriptions in. You're part of that community. People know you and know a reputation and love a little community pharmacy. But long-term care at home is different. It's much more business to business, working with providers, working with other community health workers who are in the home and seeing the needs of the patients. So it makes you think a lot differently about pharmacy and the opportunities that surround it and how you can connect to your community.
I loved when you called the pharmacist or the pharmacy the hub, because it's so true. Instead of this segmented, siloed approach to healthcare, you are able to really bring everything together. You could be providing those services for their medical equipment, being able to have immunization clinics for those patients in their homes,
Yeah.
being able to help them increase their medication compliance. Even if you just have the packaging and someone has dementia, you need someone to remind them to take the medication. So thereby having your caregivers, the Happier at Home caregivers, remind them to take their medications, and they're not administering, as you know, they can't do that. So it is, I think it's almost giving our pharmacy owners a responsibility now. Asking them to embrace thinking outside the box, step out of their comfort zone, be able to expand in those different ways that are going to help your community to be able to stay home and improve their quality of care, keep them out of that healthcare system, out of SNFs or skilled nursing homes, and out of the hospital. So awesome. I love you guys so much.
feel the same way.
Yeah, thank you. And so I do you have anything else that you wanted to talk about? Any events coming up or anything like that? How would we get a hold of you if anyone wants to speak with you?
Oh, well, the best way to get information on the Long-Term Care at Home Pharmacy Network is on our website. It's the letters. I'm giving the industry another set of letters that they have to remember. It's ltcah.com, long-term care at home.com. That takes you to our website. You can find all the information on there. There are blogs on there. We actually release 2 new blogs a week that just talk about what's going on in the industry, what's going on with long-term care at home, questions that we've been getting into our inbox, so everyone has access to. So those blogs are always a really good resource. And then, of course, they can become a member and get access to everything that the network has to offer.
You don't have a conference or anything like that yet, do you?
Not yet.
Was that
Yeah,
a bad question?
we
Hint,
need to
hint.
host a conference. It would be interesting to see what opportunities come along of, the long-term care at home summit or conference, or
Mhm.
I think that there's definitely opportunity out there to be able to do something like that. So we got to get the rest of the pharmacies on board and supported in this, so that we can make something like that worthwhile for them.
Definitely.
Well, as someone who runs a network, I know how value it's become, because this is bigger than any one individual. And this is not about Lindsay. This is about what's happening to long-term care at home and the services that are being provided. And I want to see pharmacists do what they have been designed and trained to do, which is become the hub of healthcare. Just as both of you were talking, that's exactly what I was thinking. I see the team members that you've put on your advisory and leadership team, and Stephen Cava, who is out there looking for the legal side of things, and the one and only Paul Shelton, who is a rock star in long-term care pharmacy and understanding compliancy and operations. Lindsay, I just want to say I'm extremely impressed. Pharmacy Podcast Network wants to support you. We will definitely do so. And anything that we can do to keep connecting dots, so that more pharmacists and pharmacy owners can get involved in the right way, long-term care at home. So thank you.
Well, thank you so much. And, it really is true when you take a look at the individuals who are here operating the long-term care at home pharmacy network. I think that we have an amazing group of people. You have not only pharmacy owners who have done this, who, have been through it, who understand the intricacies of the contracts and the inventories and different types of workflow. But then you also have the experts like Paul and Stephen and Leanne, and we have just so many great resources at these pharmacies' fingertips to be able to take advantage of, and we really just want everybody to take advantage of it. Like, we're like, please.
I gotta say, shout out to Leanne Haley Brown. Also, she's a great person. She's literally a great person, human being, and such a wealth of knowledge. And I'm so excited to see she's on your team too.
Yeah, she's a great one. She's one of the good ones out there.
Yeah, I agree.
Pharmacy.
So, any parting words there, Todd?
Yeah, I was going to say, pharmacy owners, this is a shout out to you. Take advantage of this opportunity to learn from Lindsay and partnering with Debbie, and understanding you have a very, very unique opportunity within your community. Your community has looked to you for years as a community pharmacy owner, and now you have additional resources to bring to light and demystify long-term care at home through the long-term care at home pharmacy network. You can find more information by going to ltcah.com. That's LTC, long-term care, at home.com. Lindsay, you have to promise that you're going to come back on Happier at Home PRN and give us some updates.
Absolutely. Thank you so much for having me.
Yes, thank you so much. It was a great conversation, much needed conversation.
Yes.